Buenas tardes, or as they say in this particular slice of paradise, another day, another delightful dilation.
All right, Dr. Yuri here, still wrestling with the AI, or as I like to call it, Skynet's misguided medical intern. Today's challenge? Old Man Hemmings. Delightful fellow. Smells faintly of pipe tobacco and existential dread. Comes in complaining of, you guessed it, issues with his micturition. Specifically, he claims his urine stream has developed a penchant for dextroscoliosis, veering sharply to the right. He described it as like a rogue garden hose trying to water the neighbor's prize-winning petunias. Now, any sane human with even a passing familiarity with basic plumbing, let alone human anatomy, would suspect a benign prostatic hyperplasia, perhaps a urethral stricture, or, heaven forbid, just a slightly off aim. But no, the AI, in its infinite wisdom and utter detachment from reality, had a different trajectory in mind. I input the symptoms, which included, verbatim, urine stream listing hard to starboard. The AI processed this with the usual whirs and clicks, probably calculating fluid dynamics in a zero-gravity environment. Then the diagnosis flashed. Suspected unilateral ureteral obstruction secondary to an unconfirmed intra-abdominal mass requiring immediate robotic-assisted laparoscopic nephroureterectomy with concurrent lymphadenectomy and postoperative brachytherapy. I blinked. Old Man Hemmings blinked back, looking profoundly confused. "Doctor," he drawled, "did that machine just say, 'I need my kidney removed because my pee goes sideways'?" "Mr. Hemmings," I sighed, rubbing my temples, "the machine has an imaginative interpretation of your urinary kinetics. It believes your bladder is hosting a surprise party for a rather aggressive growth, and the only solution is to essentially replumb your entire lower abdomen with tiny robot arms." He just scratched his head. "Robots in San Pedro de la Orana? Son, the most high-tech thing we got is a hand-cranked well." "Exactly." So I grabbed a good old-fashioned rectal exam glove, yes, still a cornerstone of urology, AI be damned, and lo and behold, a bog-standard enlarged prostate. A little tamsulosin, and Mr. Hemmings will be watering his own petunias straight as an arrow. The AI, meanwhile, is probably busy designing a space station capable of housing a full surgical suite for extraterrestrial prostatectomies. Sometimes I'd swear this AI is less about diagnostics and more about trying to justify its own outrageous existence. And so, as the sun sets on another day in this medical miracle adjacent corner of the world, I, Dr. Yuri, bid you adieu. Remember, if you ever find yourself struggling with a wee bit of a struggle when micturating, or if your local shaman diagnoses you with an angry rock due to an unfortunate encounter with the moon, fear not. Just remember, somewhere out there there's a highly trained, slightly bewildered urologist who's probably just finished negotiating sterile field protocols with a goat and is now contemplating the existential implications of a digital rectal exam. Until next time, may your bladders be clear and your diagnostic challenges be easily Googleable. And please, for the love of all that is medically sacred, lay off the spicy peppers, especially during a full moon.